I'm Mike Smith, sitting in for our chair, Steve Sereboff. Tonight's program is on scientific literacy and the price of misinformation. Some things of note for tonight: you can use the Q&A box at the bottom of your Zoom window to submit questions during the program. Time permitting, we will meet online and Appreciate Social for networking after the program. And that link will be provided in Zoom's chat window towards the end of the program. Before we get started, I want to thank our premier sponsors: JP Morgan Chase, Amazon, Nassif Hicks Harrison Company, SoCal IP Law Group, Chill Strategic Partners, Caldwell Intellectual Property Law, Founders Capital Partners, our premier in-kind sponsors, Fowler, Large, Archibald and Spray, Pacific Coast Business Times, SB Independent, EdHat, and our 7 additional supporting sponsors. If you are interested in becoming a Ventec sponsor, please contact us through our ventec.org website or send us an email at info@ventec.org. Tonight's program was produced by Nini Munoz and Hans Hogue. I'm going to hand off now to Nini, and I'll return at the end to close the event. Enjoy.
The Surgeon General of the US recently declared that false misinformation around COVID-19, and specifically COVID-19 vaccines, posed an urgent threat. Unfortunately, he wasn't wrong. The COVID-19 pandemic has exponentially amplified not just misinformation, but also the public health threat that this represents. Social media platforms specifically have become a breeding ground for all types of fake news, misrepresentation of data, and confusion, undermining the immunization goals that we have, as well as the risk mitigation strategies put in place for containment. Health misinformation, as you'll see through our panel, is not new, and it is quite broad and far-reaching across the fields of nutrition and even beauty and skincare. And that's what our panelists are going to be tackling. Specifically, how do we combat it? And how do we leverage the social media tools at our disposal to teach scientific literacy? So I'm going to go ahead and share my screen now. So even though the US had an early start with its vaccination campaign as early as December of last year, currently it is lagging behind other countries that had a later start, with roughly just over 50% of the total population fully vaccinated. Other countries like Denmark, Israel, Greece, and even Japan have surpassed our immunization threshold at this point. Now, the Kaiser Family Foundation has been conducting vaccine attitude surveys throughout the duration of the pandemic. And the last one is really interesting because it does show how information available shapes our perception of a certain situation. So relative to those who gladly took a vaccine or are willing to take one in the near future, people who opted out of vaccines or who had no interest were likely to think that they wouldn't be as sick if they were to contract the disease, and they were likely to think that the vaccine was a lot riskier than COVID-19 itself. So there's a couple of interesting trends in the United States that I want to point to. So on the left is data from the University of Southern California. And they actually looked through 30 million tweets and 7.5 million Twitter users. And they were able to use geodata to map the share of unreliable to reliable information across the different states across the US. And there's an interesting correlation with the percentage of fully vaccinated people. So it turns out that in the places where there was more sharing of unreliable information or misinformation, there was less vaccine uptake. Now, on the right is a correlation between vaccine hesitancy attitudes and vaccine uptake. And this was carried out by the COVID-19 Consortium for Public Health. It's a collaborative effort between Harvard and Northeastern. And we observed that, again, there is a strong relationship, strong predictive value between vaccine hesitancy as determined by surveys back in March to current vaccine uptake. The big question is, does unreliable information or does misinformation affect vaccine attitudes? Does it actually lead to vaccine hesitancy, or is hesitancy driving more misinformation? In reality, it's a little bit of both, but a study by Lumba and his colleagues assessed vaccine attitudes across 8,000 participants, both in the US and the UK. Then they randomized the individuals and they exposed them to misinformation. And it turns out that relative to those who were not exposed to misinformation, those who were now less likely to take a vaccine and were feeling also more unsure, leaning towards no after that exposure. So this highly suggests that exposure to misinformation really affects individual health decisions. So currently, as it stands, global mobile users have reached just under 67% of the world's total population. There are about 4.5 billion social media users around the world, and internet users alone increased by 250 million last year. So we have a lot of users and we have a lot of information and misinformation. The main issue being that falsehoods diffuse significantly further, faster, deeper, and more broadly than truth in all categories of information. So this was a landmark study done by Vasuji and his colleagues in 2018, and they found that fake news can reach up to 100 times more people. And contrary to popular belief, this is not actually driven by bots. So the world has changed a lot, and along that there's more uncertainty. If we look back at 1900 compared to now, we see that life expectancy has increased close to 30 years. There is almost a 300-fold reduction in infant mortalities. But at the same time, the demise of infectious diseases really have shifted the burden of these poor health outcomes to chronic conditions in an aging population. And while advances in public health and modern medicine really have improved overall health and longevity, there's still a lot that we don't know, a lot of gaps in scientific knowledge and medical understanding, just because a lot of these improvements happen relatively quickly. And what happens then is that with the internet and the World Wide Web and mobile devices, we have increased access to all kinds of sources of information, reliable or not. And that in itself is problematic. So our panelists today, I'm happy to say, are joining us from around the world, and they're going to help discuss these really interesting and relevant topics. So from Ireland, we have Dr. David Robert Grimes. He's an author and physicist and cancer researcher, and he's going to be talking a little bit about what makes somebody vulnerable for falsehoods and who is likely to propagate them. From Australia, we have Dr. Michelle Wong, who's a PhD in chemistry, and she's a science communicator. And Michelle's quite a veteran in science communication and scientific literacy. She actually has been doing this for close to a decade, debunking beauty myths in the skincare industry. And she'll be talking a little bit about how there's a similar narrative in the beauty industry and as far as compared to vaccine hesitancy, but also how it affects beauty brands. From New York, we have Dr. Mauricio Gonzalez Arias. He's an internal and emergency medicine physician, also a science communicator and author. And he really has been the leading voice in translating a lot of the complex scientific concepts emerging from the COVID-19 pandemic to the Latin American community. And he's going to be discussing how health misinformation really impacts individual health outcomes and how we can leverage social media to combat these. And lastly, from Texas, we have Dr. Jeff Dennis. He's an associate professor of public health at Texas Tech University, and he'll be guiding us through the implications in public health and what strategies we can leverage in public health to combat misinformation. So with that, I will leave it up to David.
Oh, thank you very much. And from where I am, good morning, because it is about just after 2 a.m. here. So if I make a few mistakes in my pronunciation, I'm not actually drunk. I'm just very tired. I'm going to jump straight into this presentation. All goes well. I'm going to show some pictures because that always makes things easier to understand, at least for me. So there's going to be a lot of little bit of repetition here. Hopefully everyone can see my screen. No one is. Okay. Scream at me if you can't. And if I'm speaking too fast, scream at me as well. So I'm from Ireland. We do speak a little bit fast. So we've already kind of touched, or Nini's already touched a little bit upon that the fact that we live in an age of the infodemic. We have a shadow plague that has been following the pandemic, and that is the infodemic. And the WHO defined that as the rise of both reliable and non-reliable information that makes it very difficult for people to distinguish fact from fiction. This paper, The Spread of True and False News, has already been mentioned, so I won't belabor it. But when I do a lot of stuff on conspiracy theories, and people ask me, how many people believe these things? Well, it depends how you measure it and when. So this is from a paper I think I did last year in November, and these numbers will have changed since then. About 12% of the population believe water fluoridation is a conspiracy, or the same number believe that GMOs are a plot to control the world's population, or that the CIA deliberately infected people with AIDS. At the time, about 15% of people thought that COVID-19 was caused by radio frequency radiation. About 19% would refuse the vaccine if and when it was available. Luckily, about a month after this paper came back, that all changed. And about 37% of people believe that the FDA is suppressing a cure for cancer. It is not, I'm afraid. So what are the three big vectors of falsehood? Where did we get into this mess from? And there's three distinct things we need to break apart. There is misinformation. Misinformation is the inadvertent spreading of falsehood. Nini Munoz's tweet yesterday, I was doing something on Sky News in the UK about that yesterday evening, for my time, different for your time. That might be a classic example of misinformation. I heard something from a friend about this, it happened to someone. Disinformation is a bit more sinister, and we'll come back to that in a bit. It's the deliberate proliferation of a falsehood for whatever reason. And very intimately related to that is the final cousin of this trio is malinformation. And these are attempts to undermine something by spreading partially true or exaggerated information, but out of context. Imagine like bad mouthing someone or saying, taking something out of context. That's what malinformation is. It often is linked in with disinformation. Misinformation is the most innocent of all these vectors, and it often arises from misunderstanding. I sometimes give this to my students just to wind them up when we're doing stats. Cancer rates are going up. And this is true, by the way. Cancer rates go up and up every year. And this is an old graph from CRUK. You can see 2011 predicted, so it's like 10 years ago. But the trend follows. So is the world becoming more carcinogenic? And people start looking for reasons it might be, and they start panicking. Well, the real reason that graph is going up and up and up is that we have less of this. Less of us are dying of cholera. Less of us get the bubonic plague. Less of us are even dying in wars on average, although the 20th century did mess up that stat a little bit. It is a symptom of improved societal health. And I won't get into the stats of it and all the paradoxes, but it's an easy mistake to make. But it can be more sinister. For example, I come across people like this an awful lot, people who will tell me that cannabis cures cancer. And they will tell me it cures cancer because they read a study where THC, the psychoactive chemical in cannabis, killed some tumor cells in a Petri dish. And I will go, that's fabulous, except it's really easy to kill cancer cells in a Petri dish. You can sneeze on them. You can forget to put the incubator exactly 37. You can pour bleach on them, water on them. You can just look at them the wrong way. The thing is that cancer therapy has to kill tumor cells in a person without killing the person. And that is something THC cannot do, unfortunately. And the reason this kind of stuff bothers me, and we need to be very aware of it, and this is a great paper by Skylar Johnson from JAMA Oncology a few years ago. Patients who fall for these narratives, and they fall for things like complementary medicine, alternative medicine, things like that, when they have cancer, curable, survivable cancers, their outputs, their outcomes are an awful lot worse. Now, that doesn't look like much in a survival curve, and some of you can read Kaplan-Meier curves, and I'll belabor it if you don't, but that translates to about twice the hazard ratio. So in the same period of time, someone who goes for the conventional therapy or the stuff they read online or heard from their cousin has about twice the risk per unit time of dying. And that is because they either reject conventional therapy or they delay the ontake of it. You see something with vaccines as well. We've seen a lot of cases of people that believed anti-vaccine propaganda and have since very much regretted it, sometimes on their deathbed. So this does have a real consequence. What about disinformation? Deliberate falsehoods, propaganda. Why would people spread deliberate falsehoods about health? And that's the distinction between misinformation and disinformation. Misinformation, kind of innocent, disinformation, a lot more sinister. I won't get too much into the psychology because I suspect that maybe Jeff might talk about that a bit later on. But the weird thing is that ideological motivation is a huge, huge factor. We are not the most rational of creatures. We might pride ourselves in thinking we are not. We tend to have a conclusion and distort evidence to fit that. We also engage in motivated reasoning, which is where we bend evidence to try and fit a preconceived notion. Confirmation bias is example some of you will have heard of. So if your starting point is, I don't trust the government, and someone tells you there's a COVID vaccine out and the government recommended it, because your overriding narrative is, I don't trust the government, it becomes very easier for you to dismiss that. And it becomes perversely quite easy for you to lie or distort it, to misrepresent your ostensible opponent's position. And that is a bizarre thing. The philosopher W.V. Quine talked about our web of belief. And this was the idea that all of our beliefs are interconnected. Okay, that if you pull the thread one way, so if I start accepting that a big conspiracy can happen on one thing, it pulls the other threads till I start thinking conspiracies are everywhere, because I've already accepted that belief. I've crossed that Rubicon and everything follows. This is why conspiracy theorists tend not just to hold one belief, they hold a great deal of them. You've probably encountered that if you've been online and talked to people. And it means that they don't necessarily view distorting reality as lying. They think it's, I've heard the expression liars for Jesus in a religious context. There's something similar here. They might be bending the truth, but they're doing it for their perceived greater good. That is one of the motivations, highly ideological. And you see it in politics too. People will always bend facts to suit their narrative because that's human. The other thing, and why do I have a picture of Putin here and a burning 5G tower? The other reason is that sometimes disinformation is deliberate. We are kind of useful idiots to it. So it was found at the beginning of the pandemic when 5G was being blamed as a cause of it. I was doing a lot of work at the time. A lot of that disinformation was being stoked up by Russian and to a lesser extent Chinese forces. And why would they do that? Well, they did the exact same thing with HIV/AIDS. And I write about it in the book quite a bit, a thing called Operation Infection in the early 80s. If you generate discomfort in your perceived enemy nations and discontent and distrust, it's beneficial to you. Russia have been doing this for a very long time. I won't get into all the details of it because we don't have time, but we certainly know that some disinformation is deliberately stoked to exacerbate tensions in different nations. Why do people believe this stuff? Well, one thing is epistemic certainty. We like to think we understand what's going on around us. Conspiracy theories give you a simple narrative. Yes, no, good, bad, and you're always the good guy and they're always the bad guy. It also gives you a sense of well-being, that you are not a sheeple. You know stuff. It's very alluring. We don't like randomness, and we are averse to randomness, so this helps. And unfortunately, as some of you have probably realized, there's a huge egotistic component, particularly in people that propagate conspiracy theories, because again, it's feeling special. I did something on this earlier on in the year, and there's something that I roughly call the spectrum of medico-scientific acceptance. It's a bit like vaccine hesitancy. You have people that will accept all science and people who will reject it all, and you have modifying influences. And there are things we can do, which I will come back to, but I just wanted to mention it here, that there are things that modulate you up and down the spectrum of acceptance. Why is all this damaging? Why do we fall for this? Well, the first thing is availability heuristic. You got to remember, people that are exposed to this information, sometimes people that spread it are actually victims of it too. It's not a simple binary. We see that with vaccine hesitancy. If you are, and also Nini has already mentioned this a bit, so I won't dwell on it. If you are exposed to vaccine hesitancy, and she mentioned a really good paper on that from this year. Here's a paper from 7 years ago that found the same thing. It nudges you towards refusal. And that's what a lot of this disinformation does. Availability heuristic is part of the reason. We cling to things we remember, and anti-vaccine claims are very scary. So we remember them and we afford them more weight than we should. Illusory truth. We being constantly exposed to something actually predisposes us to start thinking there might be something to it, even if we know that's not the reality. And of course, they'll have big impacts. What can we do about this? Well, there is good research emerging that we can kind of vaccinate against this information. If we know it's going to come and we learn how to identify it, we're much less susceptible to it. Critical thinking, I will always harp on. We need to get better at it as a society. Information hygiene, what does that mean? Well, the same way that we all wear protective masks, or most of us do, to try and not expose ourselves to pathogens, we have to start viewing information as pathogenic, potentially infecting us or infecting more vulnerable people. We have to treat it that way and be very careful before we accept things. Debunking works too. There was a paper out in PNAS this week, some of you might have seen. We are emotive, and I want to tell you one story before we finish. In Ireland, a few years ago, we had a massive HPV vaccine confidence crisis. The HPV vaccine can prevent cervical cancer, genital cancer, and penile cancer. It's absolutely life-saving. And we had, like Denmark and Japan before us, Japan had a crisis of confidence based on anti-vaccine disinformation, and their rates dropped from 70% one year to 1% the next year. In Denmark, it went from 79% to 17%. In Ireland, we had that arriving in around 2015. It went from 87% to 50%. And the reason it changed was twofold. There was a small reason that a bunch of scientists and doctors and media people got together in a vaccine alliance, and I was a part of that, and there were wonderful people doing that. But the most important person is this person here. Laura Brennan was only 24 when she was diagnosed with terminal cervical cancer. And she decided she would spend the last time she had remaining campaigning for the vaccine. And I won't read you, she was an incredible woman, but she put a human face in it, and she would say to the media, I am the reality of an unvaccinated girl, not this nonsense you're reading. She was incredibly powerful. I was very lucky to have her in my life. She passed away in 2019, but she has made a massive impact in Ireland. And now we have some of the highest vaccine uptake. We reversed it from 51% up to the high 90s in the county where Laura is from. So I think this shows a really important message. To change hearts, you have to change minds. People are afraid, and we need to approach that. A lot of health disinformation is emotive and identity driven. Proponents can be victims too. The crucial concept, zero shame in changing your mind, or your own mind as well, or anyone else's. The only shame is not doing it. The last thing, we are not our ideas. Ideas should be changed. We can keep a bit consistent on that. And finally, no one will change anyone else's mind. We can only give someone else the freedom and the tools and the information to hope they change it, and the space to do so. I'll be here to talk later on. I'll let the next speaker come on. In America, for some reason, my book is called Good Thinking. They renamed it for some reason. But if you want to chat later on, I hope the next speaker will have much more useful information than I have. So I'm going to pass back to Nina, I think. Nini, sorry, apologies.
That's okay. Half of my friends don't get my name right anyway. So misinformation is far-reaching, even into like the beauty industry. And one of the veterans of this is Dr. Michelle Wang joining us from Australia. Michelle?
Hi, so my name is Michelle, and I am also known as Lab Muffin Beauty Science. So my formal education is in chemistry. My professional background is mostly in science education. I'm the founder of Lab Muffin Beauty Science, and I talk about the science behind cosmetics and personal care products in layperson terms on my blog, YouTube, and on social media. And I've been doing this for almost 10 years. My content mostly explains how products work and how to use them effectively. And a lot of this is debunking misinformation. It comes up all the time. So there's always a new myth about sunscreens, for example. Benzene giving you cancer was a recent one. Some misinformation is actually perpetuated by authoritative sources. And this is always a little bit more tricky to debunk because you need your audience to understand how to critically assess sources and the actual data. So for example, this is one I've done recently. You might have heard that sunscreens are getting banned because they're bleaching coral. But this is actually based on studies where corals were spiked with much more sunscreen than you would ever find in the ocean. When I first tackled this in 2018, I had a lot of trouble because I had to convince people that they should listen to my interpretations of the data backed up by tweets from one of the most influential top coral scientists in the world, but still it's a tweet, opinion pieces from coral scientists, and a coral scientist mailing list. On the other side, we had peer-reviewed studies. We had governments banning sunscreens in certain places, and we had the NOAA. So this was a bit of a hard sell, but I think I managed it reasonably well. Thankfully, earlier this year, there was actually a couple of new reviews that came out that backed up what I was saying, which is great. It made my job a lot easier. And one of the authors of this review actually has commented on my Instagram backing me up, which was super helpful as well. Here's another one. The fact that chemical sunscreens absorb UV and physical sunscreens reflect. This is actually what most dermatologists say, which is understandable because the American Academy of Dermatology actually has this on their website and every dermatology textbook has it. But the problem is how UV interacts with metal oxides is physical chemistry and not dermatology. There's no skin involved in this. So physical chemists have known for a long time that metal oxide sunscreens will absorb UV rather than reflect, and that's what's in our sunscreens. And here you can see one of the big issues I've come up against with science communication. The myth is always nice and simple, and the truth, the science, is always complex and messy. To convince someone, you need to give them an explanation that makes more sense than the misconception. And that's hard. You're going against confirmation bias and their current worldview. And I think my background in teaching helps a lot here. I've had a lot of experience in face-to-face teaching where you can see students giving you real-time feedback. You end up building a toolkit of effective teaching techniques, explaining the same thing in lots of different ways, chipping away at misunderstandings, and getting right to the root of a misunderstanding. It's usually a lot easier to explain the myth rather than the science. We have this law here, Brandolini's law, where it very succinctly tells you how much energy you need to get rid of the BS. I think the most important thing in a successful debunking is that you need to give people an explanation that makes more sense than their current misconceptions. And this is hard because you're going against confirmation bias. You have to make this new information fit in with their new worldview. You have to really help people work out how their misunderstanding fits in with the rest of their worldview, and you have to tidy up all the little bits to make their worldview make more sense again. In the early days, I had a lot of scientists telling me that people who care about beauty products don't care about science, but I think I've proven them wrong with my numbers. Science can be intimidating, but I think the fact is most people want stuff that works, and lots of people realize that science is a really good way of navigating this. But for a long time, people didn't really bother explaining this stuff in detail because they assumed people didn't care. So I think my numbers are a good way of seeing that. I've also had a lot of press coverage. And a lot of the journalists who have interviewed me have actually told me that they're beauty product consumers themselves, and that's how they found me. So beauty is a massive market. There's a lot of opportunity for science communication, and now I'm lucky enough to do this as my full-time job. One of my main funding sources is sponsorships with brands, and at the start, they mostly told me to just review their products, but as I got better known, they have been specifically asking me to make content that just explains stuff or just straight up debunks misinformation. And brands are increasingly willing to invest in debunking misinformation because it's costing them when consumers believe the seductive myth instead of what is actually true. Multinational brands have teams of scientists making sure their products are safe and effective, but safe and effective products aren't enough anymore because misinformation is spreading so much faster with social media algorithms. Here's an example of a video I did for Pantene.
Can you check for silicone buildup by scraping your hair with scissors? I did an experiment to find out. I washed 2 samples of hair with clarifying shampoo to remove buildup. Then I put Pantene conditioner on 1 sample, dried them, then scraped both with scissors. White stuff came off on both samples. This is what it looks like through a microscope. They look pretty similar. So it's not buildup from conditioner. What is this white stuff? If you look through a stronger microscope, the white stuff looks like scaly roof tiles. The outside layer of your hair, the cuticle, is clear and looks like roof tiles. So scraping your hair is literally scraping off part of your hair. And afterwards, this is what your hair looks like. Don't do it to your hair.
So this scrape test was spreading on social media as a way to disparage Pantene and sell more expensive products. Pantene asked me and a few other beauty science influencers to debunk it.
Can you check for silicone?
Here's another example of misinformation that's caused serious problems for companies: clean beauty. The idea is that products need to be free from certain harmful ingredients that are supposedly harmful, according to in vitro and animal studies, but human studies have repeatedly found that there's no effect. If you're familiar with drug discovery, you know that this doesn't make sense, because if everything worked in humans like it worked in cells and animals, then we would have cured cancer a million times over. One of the main class of ingredients that's been fearmongered about are parabens, and these are preservatives that are supposedly linked to breast cancer. To understand the clean beauty problem, you have to know the way the beauty industry makes products. A product developer gathers market intelligence to work out what consumers want, and they produce a brief. Sometimes there are scientists involved in this stage, but usually there aren't. Usually they're going off what is backed up by slick marketing and from just what consumers are saying. The EWG is one example. This is a really common source of misinformation. The brief then goes to the scientists who make a product to match the requirements of the brief. So the scientists, even though they know from this not very slick looking scientific sources, they know that parabens are fine, they have to still make a paraben-free product. So the problem is that the tail is wagging the dog. What consumers want determines what products are marketed, and all of this is done well before scientists ever get their hands on it. So this is a positive feedback loop. We have ads on billboards, TV ads, brand spokespeople who are reinforcing and confirming the misinformation that the consumer already knows. And this clean beauty pseudoscience started with smaller brands, but this very simple marketing fiction has spread so much that even giant beauty conglomerates who have thousands of scientists who can tell them that these ingredients are perfectly safe are still using this strategy. And so if these giant conglomerates are saying that parabens are bad, then everyone's going to believe that parabens are bad. So you might be wondering, what is the real problem with this? The next part in product development is microbial testing. Cosmetics are really good food for microbes. If you use a contaminated product and you get an infection, you're probably going to sue the company. And parabens are really effective preservatives. You only need a tiny amount to make them work, and they have really low irritation and allergy. They also have almost a century of safe use. So if you take out these parabens, then you have to put in other preservatives that don't work as well. And this is blindingly obvious to the scientists who are watching all this microbial testing happen. They also cause more skin reactions, and they have unknown long-term health effects. And the result is that brands are being forced by misinformed consumers to stop using preservatives that they know are safe and effective because of this BS reason. And that opens them up to liability. I've actually consulted with a few large companies about how to debunk this clean beauty misinformation, and the fact that they're asking me to do this shows that it is impacting their bottom line. Now, it isn't just private companies that are concerned about this misinformation. I talk a lot about sunscreen, and I think the cost there is pretty obvious. Sunscreen is an anti-cancer drug in the US and Australia, and social media myths about it being bad for yourself or the environment, or telling you to use it incorrectly, this leads to public health impacts and costs to society. But there are still some more subtle impacts as well. So clean beauty and ingredient fearmongering is actually why I picked beauty as my topic area rather than what other people have suggested, like quantum computing, because the same people making decisions to buy beauty products are the same people who are making decisions to get vaccinated or get their children vaccinated. And you don't have to know anything about cosmetic science to see the parallels here. If you're worried about putting in like different toxins on your skin, then you're probably not going to want to inject them either. And the people who are pushing these clean beauty messages are often also pushing anti-vax messages. So one of the main inspirations for me to start a blog in the first place was the excellent blog Science-Based Medicine. They have lots of articles debunking vaccine misinformation, and I saw so many science communicators trying to tackle these topics. But by the time someone doesn't trust medicine, it's really hard to change their mind, especially when it's on a topic as emotionally loaded as the safety of their children. So what about further up the pipeline? If I could inoculate people against this sort of logic when they're less emotionally involved, maybe they won't fall for it when it's a much more important topic. And I've had lots of success debunking clean beauty. There are lots of people who have told me they used to believe in clean beauty and now they don't. And there are some people, even though I haven't really said it much, some people have drawn these parallels with vaccines. So I guess what are my main takeaways here? People have an appetite for learning, even in places where you might not expect. I think that's something fundamental to all humans. We just like learning things. There are lots of science communication opportunities, especially in areas that are neglected and areas that are emerging in terms of science communication. Debunking misinformation, I think, can have some really long-range impacts as well, especially in unrelated fields. And I think it's really crucial that you look at creative thinking, be willing to experiment, and have empathy when you're trying to effectively communicate science. Yeah, so that's all I had to say. I will pass it on to the next speaker, or I'll pass it back to Nini.
Thank you, Michelle. That was fantastic. I really like those takeaways, and we'll be talking more about those at the end. Our next speaker is a friend, Dr. Mauricio, and he is joining us from New York, and he'll be discussing individual health outcomes and the impact of misinformation.
Thank you so much, Nini, for your nice intro. Thank you, Ventec, for having us all here. This is a phenomenal opportunity. I gotta say that I'm delighted that I'm learning a lot. I'm gonna touch upon what David said. First of all, David, giving that sort of lecture at 2 a.m., you're a legend. All the facts that you share are just right on point. The facts that you presented just highlight what the society needs to know about misinformation and how we can counteract. As for Michelle, well, I think if there's an industry that has been preyed on misinformation is beauty. And it's really tough to change people's minds. And the perspective that Michelle gave was just also very, very good. Now, David and Michelle, they shared facts. They shared part of the experiences in industry. What I'm going to share is my perspective in real life, in what I do, which is basically taking care of patients. First of all, I want to start saying that healthcare is definitely not prepared to handle misinformation. The impact of misinformation is basically destroying the roots of healthcare. And why is that? Because we don't have the resources, we don't have the knowledge, and we don't have the time to address it. So, and I just want to give you a quick example. When I see a patient in the office, you know, you've heard it before, you don't have a lot of time. You might have 25, 30 minutes of quality time. And then sometimes 10, 15 minutes can be spent addressing misinformation. Now, in the medical community, we have to address a lot of things. When we see our patients, we have to address vaccines and drugs and procedures. And just to give you a quick example, colonoscopies are one of the most life-saving procedures we have in America. And there's a huge wave of misinformation regarding colonoscopies. A lot of people are thinking that they're basically money makers for the government and for certain industries with no clear benefit for humans, and that cannot be further from the truth. And when a patient comes to you and they have that thought settle in their minds, it takes a lot of time, it takes a lot of energy, and it takes a lot of emotion to try to basically dissuade them from thinking that, and you're not always successful. So that's what I say, that in healthcare, that healthcare is definitely not prepared to handle misinformation, and we need help from experts such as Michelle and Nini and David and Jeff. Okay, so another thing that I want to say is that David said it before, critical thinking. A lot of people say, I'm a critical thinker. How can we deal with this? Because critical thinking is so necessary nowadays. And I just want to say that definitely critical thinking is necessary to handle and to separate facts from truth. But in order to have critical thinking, you have to have clear-cut facts in your mind. And these facts can only be taught to you via academia. So If you go to med school, you will learn about medicine. If you go to engineering school, you will know about engineering, and you need those facts very particular to that area of expertise in order to have a full-blown critical thinking. That's why I think sometimes people saying that we need more critical thinkers to avoid misinformation might be quite overblown, because that would entail people from all sorts of backgrounds to understand facts that are, not very common to them, and they shouldn't be. It's not part of the daily lives. So I think, and I just want to share with you what I do every single day. And this is the second part of my talk. My recipe is basically take the most common questions my community might have and turn them into clear-cut answers that everybody can understand. In my mind, if a middle school kid can understand my answer, that is a good answer. That is a very, very successful answer. We have to make answers very, very simple to the community. And I try to do that with empathy. It's not always easy, because as a public figure, you're always subject to hate, very, very nasty comments sometimes. Nini knows all about this too. And so you have to be very calm. You have to give this perspective to your community that you're calm, that you're not losing your mind, that you're just here to share clear-cut facts. And that's, as I said, not always easy to do, but I gotta say that that's the recipe for success. The other thing is that very, very important is repetition. And that's something that's sometimes very hard for us science communicators. We tend to believe that people need or want different facts and different topics, or they're gonna get bored if they keep listening to the same tone, the same topic all over again. And that's not always true. People need repetition. Your community needs repetition. They need to know, they need to make sure they hear this message all over again, like many, many times, because that has been proven to be a factor in good decisions. Now, lastly, at the beginning of the pandemic, I've been working on medicine communication, science communication, mostly for prevention of chronic degenerative diseases through diet and lifestyle, exercise, and whatnot. And as you might think, this universe of nutrition is thriving with misinformation, terrible misinformation. So all over the years, I understood that you need to send clear messages to your community in order to avoid these waves of misinformation. However, I didn't know how strong social media would be. At the beginning, I thought to myself, well, social media is for cats and memes, and funny videos. I don't know how professional it's going to be or how impactful. And I'm here to share with you that social media is quite powerful. This is something that obviously Nini, Michelle, David, Jeff know. Social media is a great tool. It's a great tool. You reach a lot of people. And to me, what has been the most important part has been to focus on people that are willing to change. In my mind, even though, of course, you pay attention to haters, I mostly pay attention to people who ask very nice questions, that they formulate good structurized questions, because I know that's the people that it's willing to change. So social media for me has been vital. And social media, I think can be a deal breaker to counteract this. So how do we do that? I kind of had a list of things that I would suggest we do, but I would say 100% of them were discussed by David. And I think the two most important things were trust. People have to trust you. aware of the campaign that Laura did in, I think, UK and Ireland about the HPV vaccine. I actually read it in the BBC, I would say perhaps like 2 or 3 years ago. And it was quite remarkable. And I thought about her because recently a paper was published in JAMA that showed that this vaccine is decreasing by 12% in the last 3 years, if I remember correctly. And this is a vaccine that prevents cancer. We just can't let this happen. So I would say trust, number one, earn the trust of your audience or your community. If you have facts, just share them in a very simple fashion. If you don't know something, just be honest and say, I don't know. I will look it up and get back to you. And lastly, empathy. Empathy, I think that is a vital thing that sometimes we forget. I forget. And when I say empathy, I'm not talking about being mellow or trying to make things, try to make all things a soap opera. No, that's not what I mean. What I mean empathy is that we have all been subjects to misinformation at some point in our lives. We've all been there. And just to remind yourself that if you were a victim of misinformation, it's possible that a lot of people can be victims too. And, you can change your mind, you can change your ideas. So give people the benefit of the doubt all the time. And that's it. I will pass it on to Nini now.
And so our last speaker is Dr. Jeff Dennis, joining us from Texas, and he will be discussing public health. This is a really big topic, and the impact that misinformation has, not just in public health, but what kind of public health messaging strategies we need to start to thinking about in order to combat all this misinformation. Thanks for joining us, Jeff.
Thank you, Nini. I appreciate the opportunity to be here. I live in, let me get my slides shared here. I live in Lubbock, Texas, and we are not the only place in the country that has a lot of vaccine hesitancy, but certainly we have significant pockets of it. And so I get to see a lot of this firsthand, and not that this isn't happening everywhere, but I think we're sitting at about 40% vaccinated in our county, and so it provides interesting perspective, and a lot of the things that these great speakers have talked about speaks to a lot of the strategies that you have to undertake, and obviously you can only reach so many people. So I'm going to try to keep this to 10 minutes or so. I know nobody wants the last speaker to go long, so I'm going to focus really on public health messaging and try to hit on a couple of key points. I think clearly what's already been shown by many of the other speakers, we're dealing with, I think in this case, particularly with COVID-19, we have this near unending, we can't say infinite, but in human terms, near infinite amount of data. There are new published studies coming out all the time. There are studies being retracted all the time. There are experts giving opinions. And then there's raw data that in a near unprecedented manner, we all have access to. And I think that has contributed to the confusion. It's great to have access. We want people to have access, but it also contributes to some of what we're seeing. And I think perhaps specifically to David's points about malinformation. There's so much information out there. It's actually not hard to pick 5 or 10 data points that go along with a narrative that's not necessarily in the mainstream, that maybe goes against vaccines or masking or anything, and put it together in a very coherent way. And I think we've all seen that happen. And so, I think where that leaves us with public health messaging is we have to stay consistent. We have to be transparent, but at the same time, we're not going to be able to update messages with every piece of information that comes along. And I think something that I increasingly have tried to understand better in doing some surveys, both in our university and in the community about vaccine hesitancy, is kind of understanding that a lot of people really aren't looking for a lot of updates about this. They don't want to know every detail, every study about COVID-19. They are looking for particularly major decision points that change risk in their daily lives, right? You know, most are not seeking out this information. They may have some conceptualization of their personal risk that you know, is not particularly well informed, but they're not necessarily looking to expand upon that. And, you know, I think that's where really we end up with different levels of information. And, you know, I think there are some people, you know, a number of our speakers here, there's a great blog. I have young children, and there's a great blog called Your Local Epidemiologist. It's Dr. Caitlin Judelina is a public health professor and epidemiologist who has done a great job. And I honestly don't know how she keeps up with it. Basically keeps a really current accounting of here's what the risk looks like now, here's what parents should know, and has built an enormous following, right? And she's built this specific interest group based around that. But clearly at the same time, not everybody wants to know how to boil down the latest CDC information and the latest study in the Lancet or JAMA. And so I think that's what's important, is having different levels of public health communicators, some people to tell those complex messages to people who are really interested. And then those people may be able to disseminate out simpler messages when they're just talking to their friends, you know, who are not seeking out that information. And so, you know, we still have to find ways to keep our messages simple. You know, when we're thinking about vaccines, we've got to find ways to get to people who, you know, particularly, I don't think we're going to convince a lot of the hardline anti-vaccine folks, but there's a lot of people who are just sort of up in the air. And again, maybe they just have a little piece of information, but they don't have a full comprehensive understanding about what they really believe. So, you know, going back to this, that there's so much data out there, I think that, you know, I personally see we have some physicians in the area, we have some prominent figures in the area who compile a few data points that sound very logical together and have gotten people generally to, you know, confirm, it confirms people's assumptions and what they want to hear, right? That, and there, you know, for example, there's a really common theme I keep seeing lately, which people are saying, well, they're kind of conceding finally, well, yes, you can die from COVID. Then they add in now, well, you can still get COVID and die when you have the vaccine, and you can die from the vaccine. And even if those are all theoretically true, it's clearly an issue of probability, right? It's the understanding that the probability of dying when you've had the vaccine is much different, and particularly the probability of dying from the vaccine is incredibly low relative to the probability of dying from COVID-19. So, you know, I think it's important to just keep putting out clear and not particularly complex information when we're thinking about large-scale public health messaging. And you know, we can't use this we can't use the brick that says the science on it to beat people over the head with and convince them of things. We can really just give clear information. And so just a last couple of points. These are much bigger than what I can cover in 3 or 4 minutes. But you know, social networks are really key for health. And we've known this long before COVID-19. There have been lots of studies on how social networks influence health behaviors, from tobacco, alcohol use, risky behaviors, food consumption, you know, and all of those things are impacted by, you know, our families, our peer groups, the people we work with. And so I think we understand that, you know, some of the best places we can combat misinformation or malinformation is in these interpersonal groups, you know, with people Unfortunately, I've been in situations where people gave what I was pretty sure was misinformation, and I didn't have a great response at the time. And I wish I kicked myself when I got home, because I wish that I had that on hand. But again, there's just too much there to do that. But I think, again, social networks are so important. Clearly, we've seen this, as David alluded to. It's become woven in with political ideologies, and I think has become very powerful in that sense that, it's in some ways, it's not even about science. These people are who are against the vaccine are not against all science, right? But they have very much adopted these views in their that align with political ideologies, and it becomes even more intractable kind of in our current state of affairs. So the final thought on this, and this is a broad theme of kind of where the types of things I studied before the pandemic and that I've watched unfold during the pandemic, is that we've known, Nini at the very beginning showed causes of death in 1900 and 2019. And throughout that entire span, there have been health disparities, for example, by socioeconomic status. Those have been there even when the causes of death change. The disparities tend to stay there. We know that disparities tend to accumulate. Low resource populations tend to accumulate health disadvantages. And so unfortunately, I think, when we're adding in these networks of distrust, building on these networks of distrust, we have the potential to really exacerbate disparities. And low resource communities who maybe don't get great health information disseminated through their social networks, I think are potentially going to be at significant risk. And, when we're already talking about groups that are at risk for health disadvantages, for structural disadvantages that may impact their health, then, we're simply adding on rather than doing the thing that public health has been trying to do since public health started, which was to, provide, resources to give people a better quality of life and better well-being. So, that's my greatest concern. We've certainly seen this play out in some of the groups that have been particularly affected. It doesn't play out in an entirely linear way because we have, again, so many data points, but I think we will unfortunately continue to see disadvantaged and low resource populations dealing with some of these health disparities that stem from issues of poor health literacy that again kind of travels along ideology and along lines of health literacy. So I think I'll stop there. Again, I'm sure people have lots of questions, so I don't want to ramble on, which I could do, as I'm sure any of us could. So I will stop my share and turn it back over.
Okay, this has been great, and I am sure that there are a lot of questions. I certainly have some of my own, and we're going to be getting to everybody's questions. I think that we are going to get all panelists to come up front so that we can start out asking a few of them. I think specifically in regards to some of the points that Jeff mentioned, that of disparities, which we know really drives the differences in health outcomes across populations, as well as the misinformation. I think one question that I always get, especially here in the U.S., is what are some of the good strategies that we have to increase access, right? Because I think that is really one of the bigger drivers. Some people who just have a lifestyle that doesn't allow them to absorb the information or have time to absorb that information. What can we do to increase the access?
I mean, I'll just answer that briefly and leave to others. The biggest thing in a lot of the literature on disparities is taking away the barriers to resources, right? And I mean, the best thing clearly is that the vaccine has been free. If that ever changes, we could expect the disparities potentially to get worse. But we have to figure out the reasons. Are people not taking the vaccine because they're afraid they're going to feel so bad they can't work the next day and they can't afford to do that? We have to figure out ways, whether it's paying people. We've tried lots of things, but it's all about taking barriers away. that are, it can be very small things that keep people from going to get a vaccine, taking it to them, that's that type of thing.
I don't, like, if I can just jump in on what Jeff said there, I don't mean to be grim, but we need to start preparing for the next pandemic, because it's coming and it will come a lot harder. So whatever lessons we learn from this about disparities and communicate, we need to start reinforcing that, if it's an educational or societal. And I know it gets into the complicated mechanics of how the socioeconomic factors and educational attainment factors play into understanding. It's a very thorny issue, and the more divided a society is, the States, unfortunately, is a very divided society, makes that really difficult. But we really need to start thinking about that now. So in 10 years, when the next one comes, we might actually have some chance of not going through this rigmarole again. Very depressing, sorry.
So I think one question somebody posed, and of course this is, I think, something that we all encounter, and Michelle, you touched upon it, which is people want to conduct science on Twitter, right? And, and so you've got these figures, typically figures of authority. They're not necessarily scientists. Sometimes it is, political figures or celebrities, as we recently saw with Nini Munoz, who use the authority bias to spread misinformation, which is extremely problematic, because then, as Michelle mentioned, it takes a lot more effort for us to debunk a lot of that stuff. But that is continuously what we encounter, and throughout the COVID-19 pandemic, it really has been amplified, because we have a lot of doctors, and Mauricio, I'm sure you can comment on this. We actually have doctors, and even, sometimes people working as faculty in, renowned universities, who are advancing, in this case, the preprint, right? So they haven't gone through the peer review process. And of course, that gets taken up by the media and people, and it just gets disseminated, and it creates a lot of problems. So what are some good strategies around that, of, going against these figures of authority that already have a lot of the people's trust?
I think it really goes to explaining the data, like going back to the data, going back and stepping people through that process of critical thinking and critically assessing the sources. I think it also helps to point at fallacies. I know it's like a bit of a lazy way of trying to convince people that something is wrong, but just pointing to a list of fallacies and pointing to, the fact that argument from authority is a fallacy, because there are lots of people who are in authoritative positions who have been wrong in the past. And you can sometimes point to some examples as well, like Nobel Prize winners who have said really atrocious things, like Linus Pauling and vitamin C. But yeah, I think it really goes back down to what everyone has been saying on this panel. You have to teach people how to critically think, and you have to kind of hold their hand and do it at a level that they can understand, and try not to make them feel stupid as well, because everyone gets turned off when you make them feel stupid. Sometimes it helps to appeal to their innate want of feeling special. I think everyone wants to feel special, and that is something that's used by a lot of conspiracy theorists. But if you can make them feel special by teaching them how to critically think and spot these errors in logic, then I think that's also really appealing.
Well, two things come to mind. First is that I choose my battles on social media. So basically, there's a lot of topics around COVID-19 pandemic. There's the statistics bars, there's the vaccines, the conspiracy theories. I chose the vaccines. So basically, 100% of the information that I share on my social media platforms is all about vaccines, questions regarding safety and efficacy, and that's all I can do. And whenever someone comes and asks me these super niche questions about, statistics, I always direct them to Nini's account. That's what it works. In the other part about, so what I do, Michelle said it very, very well. To me, what has been working is that I'm basically telling every time I can to my community that by you getting vaccinated, you become a hero. You protect someone's lives. And I've seen a little bit more of acceptance when I share these kind of positive messages, like become a hero. You can do it. Protect your community. You know, your mom depends on you. Your father depends on you. I don't know. It might sound a little bit cheesy, but it works because it makes you feel special. It makes you feel important. So,
if I could just jump in, I absolutely echo that. And there's two things that I just like to very quickly add because it's really important. I think the first thing is absolutely, I think people fail to see sometimes the societal impact of something. And they say, what about me? And like, yeah, the reason we have speed limits on our road is that you don't go and kill your granny by mistake. It's not just about you. And it's reinforced that in a positive way. That I think that the point you just made there was, sorry, I'm like I'm on a real panel, I'm actually pointing at you. But the point is actually so important. The other thing that was just said, and it's really critical, is choosing your battles. I think no one on this panel is going to disagree that if you go on social media, you have to very quickly ascertain whether a question is in good faith, bad faith, or whether you should just keep drinking and not answer it. Having said that, I'm going to answer a question just popped into the Q&A that I'm not sure how good the faith was, so I'm going to ignore my own advice and choose a different battle. There's a question here saying that the authorities claim 99% of those hospitalized are dying or unvaccinated. This is connected to what Michelle said as well, I think. And then it says this county actually shows there's 22 vaccinated COVID deaths. That's only about 20% of the COVID deaths since April. And that destroys the authorities' credibility. Well, no, it doesn't. We've actually seen, this is a really good way of how do you parse data. So for example, in the UK, I'll give you an example I've talked about recently. 2/3 of COVID deaths over 50 have occurred in vaccinated individuals. Sounds scary, doesn't it? Oh my God. You know, well, it's not really, because 95% of people over 50 are vaccinated. That means that 5% of people are accounting for 33% of deaths. And when you do this lurking variable thing and work it out, that's roughly 10-fold increase in the risk of death. So whoever asked that question there, if they asked it in good faith, the bit of information they were missing is the how many people are vaccinated in this area of what age group and cohort. And if you put that in, it would be much safer. I don't know if they were. My spider senses tell me they're not, but I'm putting it out there for anyone who's seen that question and goes, hey, so there you go.
Absolutely. And I talk about this a lot, and it's called the base rate fallacy. And there, with a lot of the data, not just, in epidemiology, but also across all other fields, there's, statistics are, they're blurry. And unless you can stratify and you can do a more up close interpretation of that data, it's easy to be, to get the false impression that something is working when it isn't, or that it isn't working when it really is. And we encounter a lot of those discussions currently. So I have another question here is, how do you enable the audience to know that your message is in fact truth? I think this is a really good question, rather than well-supported misinformation. So I think that is an excellent question, because I think a lot of that, what we encounter nowadays is really rooted in the lack of trust. People do not trust institutions. And I think I talked a little bit about this when in the intro, and I'm sure David could speak to this as well, and so can Mauricio. A lot of what we're seeing is also, like the rise in pseudoscience and medical misinformation, and across most fields, really arises. I always say that pseudoscience creeps where science kind of lacks the answer. There's always somebody who says, I have the answer. And so much of it is because we've come such a long way in relatively a short period of time. And there's really a lot that we still don't know. And I'm sure that David encounters this, and so does Mauricio, because you probably deal with patients day in and day out, and they want to know, why don't we have something for this? Why don't we have a treatment for this? And I think that really paves the way for the alternative community to come in and say, hey, look, I know somebody that I treated with this and it works. So maybe you guys can comment on that, because that is really a prevailing theme, and really what's driving a lot of the misinformation nowadays in the medical community.
Mauricio, you have thoughts?
Well, I mean, that's my everyday life, to be honest. And I can answer you with a very sad experience that I had. As I was finishing my last months of my residency in emergency medicine, I was working in an upstate New York hospital that got hit pretty bad with the multisystem inflammatory syndrome in pediatrics. And at some point in our ICU, we had 5 kids like intubated on ECMO. It was like a terrible, it almost felt like it was out of a horror movie. Like we couldn't believe our eyes. And I remember perfectly that there was one room where the patient didn't have COVID. And the mother was talking to me and she was telling me how reluctant she was to vaccines and how she felt that COVID was a hoax. And I was dying to show her the other rooms, to say, can you see these patients? Can you see what they're going through? Obviously you can because of HIPAA. But what I mean is that sometimes it tells you that despite reality, right? Despite hard facts, some people are not wired to understand the depth of the problem. That, I mean, there's nothing I can provide. There's absolutely nothing that I can provide. And that's my experience. But I think that if we keep on doing the things that we shared here, building the trust, proving our points with empathy, at some point things will turn around. And I gotta say, I don't know how you all feel about the impact that you have on social media and your lectures and blah, blah, blah. Call me naive, but I think that, it's making a good impact. I think social media is having a good impact in decreasing vaccine hesitancy, I think. Please, David, if that's not the case, don't break my castle.
I don't want to break your heart. I'm going to try and phrase everything gently. So the first part of the question is a really good one, and it's a really tough one. If you want to talk about epistemic certainty, what truth is, we'll be here all night. And Jeff probably has opinions on that too. But what I would say science is, I think one of the problems that arises is and I would even say with scientists, by the way, I mean, I do a lot of work on meta research, and I'll tell you, scientists commit some of the worst scientific errors you'll ever come across. And poor communication, you name it, we do it. But one of the things I think the problem is people don't understand that science is a method. It is not an arcane school of trivia where people tell you facts and they change tomorrow. And that's why people get upset. They go, oh, last week scientists said this and now they say this. And that to most people looks like a weakness. Actually, that's a strength. We've now got more information, the methodology, and we've updated our prior conviction and we've gone on. That's very hard for people to parse. And it has created a space, and we've seen this in the pandemic. We have seen people with scientific and medical credentials become contrarians, I could get us all sued by naming about 10 of them, and so could you. People that have garnered huge Twitter followings, huge Instagram followings by telling people nonsense that sounds legit science. And because people don't understand the precepts of critical thinking and science, it's not about the data point, it's about all the data points. It's about all the information and the context. It goes back to that, figures in the hospital. It's all about putting it in context. If you were, and people understandably don't, and they look for authorities. And unfortunately, we need to sometimes police our own house a little bit. The medical authorities can do it to an extent. They can sometimes regulate physicians who go off script. Very hard to do with scientists, unfortunately. The academic freedom thing means you can also have cranks, and that's so difficult for people to understand. So I think it's gotten harder. I mean, I'm not negative. I hope I'm not being too negative, but I think it is just even more challenging, and we're going to have to look at how do we teach people not to spot charlatans, because it's really tough.
Yeah, I think one thing that I have found, a strategy that I found really works, and I've discussed this with some of you, is, and I would love for Jeff to weigh in, with public health messaging amidst a sea of information, because we have so much of it, right? Is that, I think prior to the COVID-19 pandemic, so much of public health messaging pivoted around the what, oh, you got to wear a mask. You've got to do this. You've got to get your vaccines. And what I have seen really in social media platforms is really a transition from the what to the why. like you wear a mask as a way of source control. It's protecting, others from you because the particles, you can get into particle and droplet physics then and explain to people the why. And so, but it is challenging, right? Because it does require perhaps a higher level of, of literacy to do that. But it's really one of the strategies that I feel has worked. And I'm wondering if we could get some of your insights in regards to how can public health leverage more of the, of the why and social media to bring that type of messaging, which I think many of us have found to be really successful to convince their audiences.
Sure. I think that unfortunately, one thing that this has shown is just how not ready we were, right? In terms of public health messaging. And, I say with, a little bit tongue in cheek, but pretty seriously, public health was the thing you only heard about when something was not working, before the pandemic, right? Most people just, you might have heard of something, people didn't have clean water here, or there was an outbreak of something there, but it was always somewhere else by and large, right? And I think we were not prepared for particularly and it's not even just the messages themselves, clearly, because we're learning new things every day, every week, every month. But having kind of the models on how to do that, and particularly preparing people for things to change, I think that's something we weren't really ready for. And that's been something that I see broadly is, for example, the kind of the demonization of Dr. Fauci as everything he does and says is evil, and people have turned him into such an evil figure in some circles that, based on simply that his very first messaging on masks was basically to try to not get everybody to buy all the N95s when we needed them in hospitals, right? There's a simple explanation, but, just like some of that, from the Wakefield study with vaccines, right? It took off, and in some ways, we've not gotten in ahead of it. Like we're just like clawing our way back up, trying to educate a few people here and there. But yeah, the why is so hard when you got so many people to turn off right away. So I'm sure others have thoughts on that, but yeah, it's a really complex thing to wade through.
I think we need more marketing strategies in medicine and public health, definitely. And I don't say this as a joke. In medicine, one of the most difficult parts is counteracting with alternative medicine, right? But now it has a new name. It's called functional medicine, right? And the name is very, very sexy. It almost provides a solution to patients, to people. It's medicine that works. That marketing aspect of healthcare is that we're lacking. And I think that public health, unfortunately, is not the same as public messaging. And we need to get better at, communicating this. So.
Yeah, and that actually takes me back to one of the conversations that I had with Michelle. Michelle, you talked a lot about the parallels between the anti-vaccine movement and then the clean beauty movement. And so much of it really is tethered around people's fear response. The clean beauty movement really does seem to target sometimes young mothers, right? Because they're very concerned about what kind of chemicals and what kind of things they put in their bodies and into their children. And so it's like, when we talk about fear responses and, once you're in a fear mode, it's much harder to accept information. So what do you think are, the better strategies for when, people are in like these fear responses, especially with like, with like clean beauty and toxic ingredients, right? Because they're definitely less receptive to information under these conditions.
I think a lot of it is just trying to be really empathetic and just try to find common ground. I think it's always good to start off with the common ground, like all of us want to be healthy, all of us don't want to accidentally hurt ourselves or our children, but then slowly explain why the way they're approaching it doesn't actually achieve those aims. I think it's always nice to do long form stuff, but yeah, I think it is really difficult with social media because everyone has such a short attention span these days. You really have to grab them and you have to try to do it as efficiently as possible. So a lot of the good science communicators I know, I'm sure all of you do this, you rewrite like the same thing a million times, you try to make it as condensed, as concise, as punchy as possible. You have to use lots of techniques that I think a lot of scientists tend to look down on. Like there are a lot of scientists who take the view that you should just give objective information, but we all know that doesn't work. You need to hook into people's emotions. You need to find vivid examples for them. You can't just show them the data. You need to contextualize things for people.
Yeah.
And I've got one last question before we move quickly to our appreciate, where we get to, mingle briefly. I know it's late for Dave. David, you're up, so you're fine. And feel free to chime in. So I got a question about, how do we know about the long-term effects? And since I've been doing a little bit of the science communication, or a lot of the science communication about COVID-19 vaccines, and somebody asked, how do we know that about these long-term effects? I'm going to go ahead and answer that question, and I'll let Mauricio and David chime in as you may. So when you get sick with the flu, you don't get infected with the flu and get symptoms 5 years down the road. You get sick right away. And that is because we have beautifully evolved to have an immune system. And the whole reason that the immune system is there is to respond right away, because otherwise we wouldn't have come this far along as a species if that wasn't happening. So when your immune system mounts a response, that is when there is the potential for, long-term, potential like long-term effects or adverse events. And that is because, if people have different sensitivities and different vulnerabilities, and something can happen, as we have seen with the Johnson & Johnson vaccine. And you see this not just with vaccines, but with other interventions. And Mauricio, you may comment with heparin, for instance. If somebody develops an allergic response or an autoimmune response to any type of ingredient or medicine, it happens right away when your immune system is mounting the response. And so historically, if you take a look at the history of vaccination, you will see that across all vaccines, all of these adverse events that could result in long-term morbidity occur within 6 to 8 weeks of vaccine administration. We've never seen anything that occurs outside of that window. And as far as COVID-19 vaccine data, we have plenty of it. The first people who received the vaccine did so in the spring of 2020, so it's been over a year. And we also have large scale, not just effectiveness, but safety data coming from all over the world, from the UK, from Israel, from Denmark, from Canada, from the US. I don't believe there's ever been a medical intervention that has been under much scrutiny as COVID-19 vaccines have, because it really has occurred under the magnifying lens of social media. And so because of that, it's almost, and I think it's a help, there's a silver lining here, which is it has forced kind of a little bit more transparency in the scientific process. And I think there are a lot more people that are interested in it. But anyway, that's just to answer the question. And as far as long-term data, we have plenty. Statistically speaking, we have more long-term data than any other intervention because we have so many more people. So we have something called the rule of 3 in statistics, that you need 3 times as many people in a trial or an intervention to capture something with 95% certainty. We have billions of people. We have more than enough to capture these rare adverse events. But with that, I'll let either David or Mauricio.
What I can tell you is that every time someone asks, I can tell you from my community about the long-term effects of vaccines, my answer is always the same. It hasn't changed at all. Is no one has a crystal ball. I don't know what can happen, but I'm going to tell you that it's highly unlikely. However, having said that, and this is something I'm sure Jeff and David know very well, these are not new questions. These long-term effect questions, they're from previous vaccines. They come from the MMR vaccine. They come from, unfortunately, the HPV and the possible link with multiple sclerosis and type 1 diabetes. So I knew right off the bat when the vaccines came along that these exact same questions anti-vaxxer organizations used, they were going to use them also for these COVID-19 vaccines.
And they also, sorry, jumping in very rudely, but I am very rude, so it's fine. One of the things is interesting as well is people don't weigh up risk and benefit. And I sometimes say to people when they go to me, but the vaccines, we don't know what's unsafe. Today in the New York Times, the official 1 in 500 Americans has died from COVID-19. The biggest stadium in Ireland seats 80,000 people. If I was going to go to that stadium and 160 people were going to die, I wouldn't go to that stadium. Okay, that's not great. The other thing is seatbelts, right? People go, a seatbelt can decapitate you. Absolutely, it has happened. It's a hell of a lot more likely to save your life. So when I have people coming up to me going, but what about the safety? I'm like, look, 1 in 500 of all the people you know in your country has died from this. And currently we're doing some analysis on vaccine safety data, even the Johnson & Johnson one. If these side effects exist and it's still contentious, you're looking at the rate of a few handful per million. If you're looking at, if you put those numbers on a big scale and say, what should you be worried about? You should be worried about COVID. Even, and I think sometimes that helps, but sometimes people will hear that. Sometimes, I mean, the other panelists might have stronger opinions than me, but sometimes it works. Sometimes you're banging your head against the wall.
Yeah, I'm pretty sure that in the parallel with the clean beauty is that, you know, it's something that I see right now is people think that, oh, like the sun being, you know, natural could be safer than like the toxins coming from like your sunscreen. So again, there is that poor risk assessment that currently takes place. And we see it across the board. It's just we, as humans, we're kind of terrible at calculating risk. So without further ado, I think that we've covered most questions. I am really grateful to have been able to get you all together. Thank you so much for giving up your time for this panel. It was a really great discussion and gives us a lot of food for thought as to what to do next and how we can you know, think about public health messaging strategies going forward, because as David said, it's going to happen again, right? We've got to be ready. And I think so much of what we have to use in our toolbox nowadays is what we have learned from this pandemic and how we can leverage that to increase scientific literacy across the population going forward before we get the next pandemic. We have a link in our chat box, and that'll take you to Appreciate, which is a really interesting, I'm not sure if you guys have used Appreciate. It's like being in a conference room. You can kind of move around the room and you can talk to other panelists and you can talk to attendees. And it's pretty cool. I really like it. So I will see you all there. And thank you so much for joining us this evening.
Thanks for having us.
Thank you.
Thank you.